So once your puppy has a chin rest with duration, then we can start adding in a second hand or some touching into that. And so what that looks like is how I start is when I offer my hand, I'm just gonna like move my fingers up under his lip of the hand that's touching him. So when I offer my hand, I'm gonna move my thumb up under his lip, reward, and then remove from that. So he's getting used to something happening when he's in that chin rest. And so we're gonna just do that a few times. Good. And making sure that if he removes himself from that chin rest, we're gonna make sure to back off. I'm not gonna follow him around. I'm not gonna continue to do it because then he's not feeling very comfortable with it. Yes, good boy. So I'm either just running my thumb up or I'm running my fingers up under his lips so that he gets used to the feeling of something touching up in there. Oh, come touch. Good boy. Nice job. You can also start adding in a second hand touch. And what that looks like is as soon as he puts his hand in there, we're just gonna touch lightly, yes, good boy, and reward for that. So really, really quick, really, really simple, because a lot of the times when we move a second hand in there, they either think it's the hand that has treats, or they think that, you know, it's something that they need to bite or grab or eat. And so if we keep it really, really short and simple, that makes it so that there's, you know, less room for confusion with that second hand coming in there. Here, bud. Good. Yes. Because I want him to stay in that chin rest when that second hand approaches. So every time he backed off from that, I just removed my hand and tried to make it a little less forward, a little less forward, a little less forward, and just like barely touched his little nose at the end of that session. And so we're probably gonna stay at that level for a little bit until he gets really, really comfortable. Yes, good. Yes, good. Again, waiting for that no movement. So if he backs his head off, I'm backing off. And we really want him to stay in that stationary position. Good boy. So once your puppy is letting you touch their face with that second hand pretty consistently, you can start to make it a little bit harder. So, you know, what that looks like would be, okay, you sit. Thank you. Doing for duration. Yes. Yes. And this is where it comes in handy for looking at teeth, so I can lift up, yes, his lips. It's okay if they get confused with shake. That's something that comes with just time. Yes. Good. Slide, yes, good. So there I used my thumb to slide back to be able to see, and make sure you want to practice on both sides. Yes. And again, if he comes up off that chin rest, then that's something that I want to back off, right? I don't want to keep doing it if that's something that he's uncomfortable with. So if I feel his pressure leave my hand, I'm gonna stop what I'm doing and back off and wait for him to offer that again. And so you can do a lot of different things with the chin rest, right? I can look at ears, yes. I can look at his eyes, yes. And this really, really helps with like vet exams when they have to do a lot of face stuff, and puppies in general, you know, can't sit still for that. This is teaching them that patience and that kind of understanding of, oh, if this gets looked at, I get rewarded. If this gets looked at, I get rewarded. Yes, good job. You can also use the chin rest for like other things. So he's learning that touching in other places still means he can keep his head on my hand, and I'm gonna, yes, reward him for that. So then you just build a lot of duration, and yes, kind of harder and easier too. You want to go, you know, back and forth. Like maybe I'll just go back to touching a little bit, because I don't want to get consistently harder and harder. Yes. And so this is something where you could add in some ear cleaning, whether it's, you know, a dry cotton thing to start with. We're going to move that into him and touch it and then reward. Then do something like flip his ear open and touch it and reward. I usually like to, because doctors have, you know, otoscopes and they stick their stuff in their ear. Yes, good boy. It feels kind of funny to them, so he popped his head up, so I might start a little bit easier, where maybe I'm just going to touch my finger, yes, to the outside of it before going in. But that's something that you can get them used to as well, is actually sticking things in their ears. So he's coming off of it a little bit. Yes. And I think he's actually lifting up his head because it feels good. He likes his ears rubbed, but that's something that you can judge too. Yes, go.